Welcome to Banff Sport Medicine's Osteoarthritis Information Modules. Bone on bone, cartilage deterioration, restricted mobility, chronic pain. Picture sounds bleak, but is it? Is a diagnosis of osteoarthritis code for game over? Is it time to hang up your shoes and open the medicine cabinet? No, absolutely not. This presentation has been developed to provide you with a foundational understanding of osteoarthritis. Let's discover what OA means for your body, your life, and what you can do to manage it. Welcome to Module 1, Understanding OA. Our objectives of this two-part series is to first, provide a greater understanding and clarity of osteoarthritis as a disease, and secondly, how you or someone you care about can manage osteoarthritis. Specifically, what is OA? What are its symptoms and risk factors? How does OA behave? And what is its future and global impact? Secondly, what can we do about it? As we explore the basis of OA management, we hope to highlight different strategies that will cater to different needs, lifestyle choices, activity levels, and goals to maintain joint function and your quality of life. Let's get right to the bare bones, pun fully intended, of osteoarthritis. Your skeleton provides the structural foundation for your body. It protects your vital organs, provides structural support, and serves as a stable base for producing movement. For today's discussion, your skeleton's pivotal role in producing movement, everything from running and jumping, to grocery shopping and using cutlery, will be our focus. Wherever two bones meet, it becomes a joint. Inside each joint you have cartilage. Cartilage, the key player in osteoarthritis, is a firm and rubbery tissue that wraps around the surfaces of bones at the joint to reduce friction and help provide smooth, optimal, and pain-free movement. There are a few additional tissues to mention that also provide cushioning, like meniscus and articular discs that sometimes work alongside cartilage at various joints. Now, we are about to venture into some details, so bear with me for about 30 seconds. There are three different types of cartilage, but most important in the discussion of OA is articular or hyaline cartilage, the type of cartilage that is on the articulating surfaces of bones. Although cartilage is a helpful tissue, invincible it is not. Cartilage can begin to wear and tear and may become wasted or worn out over time and or with injury. As the cartilage begins to wear out, the surfaces of your bones become less protected and therefore more exposed. This may lead to achiness in the affected joints during or after exercise, pain, decreased mobility, and increased stiffness. You may feel less desire to move because it hurts, resulting in a vicious circle of stiffness, pain, and immobility. Increasingly bare exposure can lead to an increase in pain due to the more exposed nerves, and less mobility due to this pain and less fluidity of movement, resulting in an even greater decrease in mobility, decreased desire to move because it still hurts, and increased stiffness, which results in increased pain. Full circle. This is OA. Now that we have a basic understanding of joint cartilage wear and tear, let's establish some additional clarity on what OA is and what it is not. Fact: OA is a progressive joint disease resulting in bone and joint damage. Fiction: OA is a disease for elderly people. In fact, OA has no minimal age requirement and has been seen in children as young as 5 years old. Fiction: if you've been diagnosed with OA, you must stop activity. Fact: stopping activity is counterproductive in OA. You need some regular activity, basic strength exercises, and other activities to keep you mobile and functional. Fiction: the only way to manage OA is with a total joint replacement. Fact: surgery is not the only option, nor the best option for most people. We've went through a lot of information so far, so let's take a moment to recap. Osteoarthritis is the deterioration of cartilage on the articulating surfaces of bones at joints, which can cause pain, restricted mobility, general frustration, and new challenges to maintaining one's quality of life. Osteoarthritis is not ageist, nor does it mean that your situation is hopeless and that you need to throw in the towel on all the activities you enjoy. Building a team of knowledgeable and supportive professionals is integral to living and living well with OA. The action you decide to take moving forward to mediate and manage your OA is up to you and your personal lifestyle goals. Under the guidance of your team of professionals and the support of your family and friends, OA will not be a frustrating or laissez-faire situation, but one filled with options, understanding, and action. Before we enter into the action chapter, Let's discuss the family of arthritic diseases, OA's risk factors, and its varying grades of severity. Osteoarthritis is just one, albeit the most prevalent, of over 100 different types of arthritis. Arthritis comes from the Latin arthro for joint and itis for inflammation. As the parent term for this collection of diseases, arthritis is defined as the inflammation of a joint, usually accompanied by pain, swelling, and stiffness, resulting from infection, trauma, degenerative changes, metabolic disturbances, or other causes. As can be drawn from this medical definition, arthritis is quite encompassing. Each form of arthritis varies in its cause, that is, wear and tear, immune system, or whether it's secondary to diseases such as Lyme or Crohn's, its varying degrees of genetic influence, its primarily affected joint locations, whether it affects weight-loading joints or smaller joints, or if it affects one side of the body or both, and finally, the specific damage to the joint itself. As you can see, arthritis is not a single, simple template of disease. As a result, different types of arthritis require different treatment protocols. What may work for patients with one type of arthritis will not necessarily work for patients with another type. Even within the same type of arthritis, one person's management strategy could be very different to another's. Arthritis can be divided into two classifications. 1. Degenerative arthritis. This is where OA falls. Degenerative arthritis is caused by the degeneration of cartilage, as we discussed in the introduction. The second classification is inflammatory arthritis. In this category, it is the body's immune system versus the wear and tear that affects the joint's function. From the long list of inflammatory arthritic conditions, such as psoriatic arthritis, reactive arthritis, gout, and lupus, rheumatoid arthritis is the most common and familiar. RA is a disorder in which the body's immune system begins to attack the body's tissues. At the joint level, this attack damages the joint lining and cartilage. Despite the technical variance among different types of arthritis, they share the same general lifestyle implications: joint pain, joint stiffness, and loss of joint function. Building a solid network of resources and professionals will be crucial for managing your personal case. Keep in mind, what worked for your neighbor or that person you once knew might be completely irrelevant to what you will need for your arthritis management. Prognosis and outcome of OA depends on comorbidities as much as the joint disease itself. This means that it's not necessarily the OA or the cartilage wear and tear that has the most significant influence on an individual's outcome. Rather, one's experience with OA is painted by a much wider picture. Comorbidities are pathologies or diseases that are not directly related to one disease, in this case OA, but they do have a direct impact on the disease and its effects on quality of life. Why are these factors so important to our discussion? As you skim the list of risk factors we are about to list, you will identify a common thread. The list of potential risk factors and comorbidities are considerably pliable. An expansive list of daily strategies can be enacted to manage these factors and, incidentally, your OA as well. It is time to start discussing how to keep living the life you want to live. Our modifiable risk factors. 1. Extra weight and obesity. The first step, work to maintain your weight. If you have extra weight you would like to lose, please discuss this with your team. Every little bit counts for decreasing the load that your joints take on. Even a 5% change in body weight can significantly decrease or increase joint stress. If that means maintaining weight instead of gaining weight as you initially adjust your lifestyle and activity demands, you're winning. However, dropping weight, which decreases the load your joints are carrying, will help aid symptoms and promote greater joint function. 2. A decrease in muscle strength. These first two factors work hand in hand. The more weight on your body, the greater stress and workload placed on your joints. The less muscle strength supporting the joints, the greater the workload placed on the joint structure. 3. Repetitive strain and loading. The more you perform a movement pattern, like bending your knees or running 500,000 strides a week versus 50,000, the odds of wearing out the cushioning mechanisms of these joints will increase. Once you do have some joint wear and tear, monitoring your activity load via high repetition or amount of impact will be an important aspect of your management strategy. Recognizing the role of repetitive movement patterns is important. However, this should not overshadow the importance of activity as part of your overall management plan. Remember, movement is good, variety of movement is better, and movement will be your top defense in living well with OA. We will elaborate much more on exercise, physiotherapy, and activity modification shortly. And 4, injury. This is only modifiable before it happens, thus the importance of injury prevention. Previous joint trauma and injury can lead to the development of OA, but it should be noted that injury does not mandate osteoarthritis down the road. To complete our understanding of risk factors, we will briefly discuss a few non-modifiable risk factors as well. In addition to your beautiful eyes, your height, and your sense of humor, there are a few OA risk factors that are courtesy of your parents. So genetics, structural and joint alignment, joint laxity, high bone density, cartilage composition, and cartilage's resiliency to wear and tear. Additional genetic factors are being researched, but at this point, research indicates simply that you have a higher risk of OA if other family members have OA. Age. OA is not a natural consequence or result of getting older. However, the more years you spend walking around and moving through your joints, the greater the chance that your cartilage will begin to wear down. And being female. Women tend to develop OA at a greater rate than men. This highlights the importance of joint management through maintenance of a healthy weight and muscle strength before the onset of menopause. To determine the severity of an individual's OA, their team will consider two assessments. Interestingly, how the patient scores on one measure doesn't indicate how they will score on the other. Even within the same person, OA can present itself uniquely on a joint-by-joint basis. The first level of testing is radiological. What is the damage to the joint itself? With an X-ray of the arthritic joint, the doctor will categorize the joint's arthritis as mild, moderate, or severe. Although the X-ray will inform your team what they are working with, it is the second measure that has a greater instructional role and influence on your quality of life and dictating the guidelines for your individualized action plan. The second measure of testing is functional. How does your joint damage affect your pain status, movement, and lifestyle? This measure assesses the impact of OA on your life. What are you able to do? What are you hesitant to try? What has changed since the onset of your OA, or what has changed as your OA has progressed? Interestingly and counterintuitively, the far end of the radiological continuum, the barely there cartilage, does not necessarily correlate with the far end of the functional testing continuum, difficulty moving, or extreme bouts of pain. Sometimes, a person with mild to moderate OA can feel functionally very limited with extreme pain, limited mobility, and significant psychological distress in the form of stress and anxiety. Another person with radiologically severe bone-on-bone OA can participate in all of their favorite pastimes without any considerable adjustments. Questionnaires and clinical examination tools have been developed to identify how the arthritis affects you functionally, but these also have limitations. It is an important role of the professional team, doctor, physio, OT, trainer, and nutritionist, to interpret the individual's function limitations and expectations. Your team will take into consideration both of these measurements. OA is the most common form of arthritis and the leading cause of pain and disability in the world. The impact of OA on the personal, national, and even global level warrants our understanding, deserves our consideration, and necessitates management. As our population grows and subsequently ages, the impact of osteoarthritis will continue to rise. The commonly held beliefs that OA or joint pain is normal, or that it's nothing, or even that there's nothing we can do about it, leads us to believe that OA cases are vastly underreported. This means that more people are living with the limitations of OA without the assistance of the available resources. In Canada, it is estimated that 4.4 million people are currently living with OA. The good news? Patients with OA are not alone. Finding a friend or peer that understands your situation, who can lend mutual support, is an effective strategy for keeping you on track. In 2010, Canadians spent $10.2 directly on OA disease management and another $17.3 billion indirectly on factors not directly related to disease management, but the incurred costs of lost wages, productivity, and home or childcare. The financial cost of OA is expected to expand to $405.1 billion by 2020. The second piece of good news? Resources, both financial and professional, are being applied to furthering our understanding of OA, while expanding our slew of management tools to ensure the maintenance of independence and quality of life among osteoarthritis patients. Yes, this is a lot of money and that is a lot of people, but we still have not discussed the heaviest piece of the global impact puzzle. Each one of those 4.4 million Canadians' daily lives, not to mention the number of people affected throughout the world. This is where OA truly draws its impact. Working to find methodologies that help manage chronic pain, any altered mobility, general confidence, and comfort of movement will help ensure your quality of life by maintaining a career, participating in favorite activities, maintaining independency, or simply having enough mental energy to deal with the rest of life. The implications of chronic pain should not be dismissed as nothing. These changes and oftentimes challenges to a person's lifestyle can often result in frustration, anxiety, and depression. In the second half, we will discuss a variety of action plans to help identify how different people continue leading adventurous and fulfilling lives after osteoarthritis diagnosis. Congratulations on the completion of Part 1. Now that you've completed the first module and established a strong answer to the question, what is OA? Please continue on to Part 2, where we will discuss living successfully with osteoarthritis.